Hi, my name is Dr. Tosin Odunsi, and today we're going to be talking about an important topic, managing faith and medicine. This is an area that can feel deeply personal, but at times confusing. My goal is to separate fact from fiction so that you can navigate your health and your faith. So let's get into it. Myth number one is that faith and medicine can't coexist. Faith and medicine can exist at the same time. I call myself a believer, and that means that I deeply believe in my faith. And when I approach my patients, when I go into work, I take God with me. And when I go into the hospital, I do pray for my patients. I do pray before I operate. And the way that I think about being a physician is that it's an honor, it's a privilege, and the talent that I have is because God gave it to me. So I want to make sure that I'm honoring God with this gift that He's given me. Of course, I went to school and I have this education and this knowledge, but I don't take it for granted that I had the privilege of going to school and learning how to be an OBGYN. When I enter the hospital, I don't leave my faith at the door. I think it's very important for me to make sure that I'm spiritually strong, because there are a lot of things that I see as an OBGYN that I don't necessarily share with everybody. There are some hard days, there are some challenging days, there are very difficult days, and I gain my strength and my courage from God. Myth number two is that prayer alone can replace medical management. I pray every day. I pray throughout the day. I pray from morning till night. I pray before I operate and before I start my day. And it's important to continue that tradition, continue that practice, because that's something that builds strength, it builds courage, it builds energy. However, there are some conditions where the wise thing to do is to seek medical counsel. And I don't separate that from my faith. What I believe is that God has given us the gift of physicians and medical knowledge. And by combining the two, we're able to come up with treatments. And I think it's important to incorporate prayer into whatever the medical management is that you and your doctor decide together. I believe that God has given us a gift of knowledge. And as we're talking through the different diagnoses and the workup, that's important to know. And there have been treatments and managements that have come into place that we can use to help you feel better. The goal is improve quality of life. So yes, pray, but also use the knowledge that we have with modern medicine to help you get better and to feel better. Myth number three is that discussing faith with your doctor is inappropriate. This can't be further from the truth. I think it's important to voice those concerns or voice those beliefs that you have whenever you want, because we can't force you to do something that doesn't align with your faith and your beliefs. So I'll encourage you, if there's something specific to your faith that clashes or doesn't align with the medical management, please speak up. And if there's something that's an alternative to the management, please share that with us as well. We're more than happy to listen to that. And then myth number four is that faith guarantees immunity from illness. This is a myth because, let me share a personal story. I was raised Christian and I'm also Nigerian. And part of the culture is that you can pray things away. While I do believe that miracles happen every day, I'm also drawing upon the wisdom and the knowledge that I have of medicine in picking a path that works for me. Picking a path whenever I'm sick, if I have a cold, I want to get better as quickly as possible. So I do take medication. And if you're more naturopathic, you may take some supplements, or you may focus on your physical health a bit more so that you can get well. The end goal is to get well, and combining faith and medicine, I do believe that makes people get better faster. There are patients who are cancer patients who have a very strong faith, and that belief I do believe it helps them recover and it helps them to fight the cancer more. And that attitude and being able to draw upon the faith is something that has healing properties as well. So I don't want us to separate the two. If you do have a faith and you also want to get better in whatever illness or disease that you're facing or whatever condition you have, please bridge the two, and we welcome both of them. Always remember that your healthcare team, your OBGYN, is here to partner with you, and we want to respect your beliefs so that you can get the best outcome possible. If you're somebody who wants to learn more about incorporating faith in medicine, I talk about this a lot on my Instagram page, Life by Tosin. Please go ahead and check that out because this is something I'm passionate about. I love God, and I think it's a big part of my life, and I want to share that with you. So go ahead and check that out. And if you're somebody who wants to learn more about women's health and enjoy these educational videos, make sure to like, comment, and subscribe. I'll see you in the next one. Bye.